One of the most ancient medical texts of Egypt, the Ebers Papyri. The Ebers Papyri was believed to be written in 1500 BC, but some of the texts go back to as far as 3000 BC. It is a 110-page scroll and 20 meters long. It has over 700 different remedies and formulas. What made this text so important is its use of herbs. Herbs like cumin, fennel, garlic, frankincense, juniper, and magic flower. It also described the circulatory system and blood flow, digestion, intestinal parasites, gynecology, depression, and dementia. Many of the herbs used in its treatments were steeped in wine. Some of the herbs were inhaled to combat asthma. Honey was also extremely important and was used to fight off infections and to heal burns and cuts. It described the use of magical talismans and amulets and rituals to ward off demons. Some of the herbs and their uses from the Ebers Papyri: bayberry, used for ulcers and hemorrhoids; camphor tree, used to reduce fever and treat epilepsy; meadow saffron, used to reduce swelling; common juniper tree, used for chest pain and cramps; cubeb pepper, used for urinary tract infection, throat infection, the larynx, and gum ulcers; fenugreek, used to cleanse the stomach, calm the liver, and for respiratory disorders; garlic, to give vitality, help with digestion, rid the body of spirits; mustard, to induce vomiting and help with chest pain; onion, used as a diuretic to prevent colds and help with cardiovascular problems; sandalwood, used to stop diarrhea; turmeric, to close open wounds, and a whole list of benefits; poppy, for anesthetic and pain. The oldest textbook on surgery, the Edwin Smith Papyrus. Named after Egyptologist Edwin Smith and translated by James Bredsted, the Edwin Smith Papyrus dates back to 3000 BC. It was written in hieratic Egyptian and was believed to be originally written by Imhotep, the famous architect, high priest, and physician. The papyrus itself only holds 1/3 of the original writings, but in it gives details on how to diagnose and treat forced trauma, particularly war trauma and from construction. It showed how to close wounds using stitches and how to prevent infection after treatment. The papyrus gave diagnosis of 48 different cases. The most important are the 6 about the spinal cord. It gave the first descriptions of cranial sutures, cerebral fluid, the external structures of the brain, the first use of the word brain, and the first description of autonomic dysfunction.